All right, let's talk about the GI tract first. We have the 8 main segments of the GI tract, which is going to be the mouth, the pharynx, which is your throat, the esophagus leading down into the stomach, the small intestine, then the large intestine, then the rectum, and then the anus where all your waste will exit from. We have 4 accessory organs that provide enzymes for the digestion process, which is the whole role of the gastrointestinal tract. The salivary glands, the liver, the gallbladder, and the pancreas. And just so you guys are aware, the main suspected purpose of your appendix so far right now is we believe that it is a site for your colon to maintain samples of your microbiome. And so that if your microbiome were to get damaged or, compromised by an infection or inflammatory process or something, that your appendix would serve as a way for your microbiome to, recreate itself. We think that's what it is. Of course, we're still not really sure. All right, so moving on. The GI tract has a massive load of microorganisms in there. And so they're not just providing microbial antagonism that we've talked about previously, taking up the sodium seats, using up the nutrients, and creating antimicrobial molecules that prevent pathogens from growing. But also, they're involved in digesting things for us, things that we can't digest for ourselves. And this is evident when you look at little babies that get colicky. A lot of times this is because they don't have an appropriate microbiome to digest things that are in like milk. So the sugars that are in milk, our bodies are not naturally able to digest those sugars. And so the microbes make it so that they will digest the sugars for us, and then we can ingest what they've broken down. So we actually depend on them for that. But also our other defenses in the GI tract. We have mucus to trap things, secretory IgA, which is present in all of your mucosa, which is any of your moist surfaces of your body. Peristalsis, that just is a smooth muscle movement that keeps things moving through the GI tract so they can't sit for too long. Saliva contains lysozyme that breaks down peptidoglycan, and lactoferrin that hoards away iron so that the pathogens can't use it. Your stomach has a low pH. Bile is antimicrobial and has a high pH. And so that difference can inhibit a lot of microbes from growing and causing infection. And then we have the GALT, which is the gut-associated lymphoid tissue, which is probably one of the most important lymphoid tissues in your entire body for helping your immune system learn what it's supposed to do. In your oral biome, we normally have bacteria in there. There are some methane-producing archaea. We can also have fungal species. Usually this is going to be the yeasts. And then some protozoa species can also be. The only thing and the virome too. For your whole body, you probably have viruses that are involved in your microbiome, but we don't know anything about them right now. And so we usually leave them out of the talk. But one thing that's not normally part of your GI system biome is helminths. Never helminths. All right. So in your esophagus and stomach, we might have 200 different species. There's a lot of bacteria that can survive your esophagus and stomach. Most of these guys are firmicutes. So these are going to be our gram-positive guys. In the large intestine, these are mostly gram-negative. So those are the gracillicutes. And so this is in the large intestine, 10 to the 11th microbes. So that's a 1 with 11 zeros after it. Microbes per gram of contents. And so another way you can look at this, if I take a centimeter of your colon, and I count the number of bacterial cells that are in a centimeter of your colon, we take a cross section about a centimeter wide, there's more bacteria in that centimeter of just your colon than there has ever been people on the planet in the history of Earth, all combined, just in a centimeter of your colon. That is a number, man. That's a lot. So this includes bacteria, fungi, again, usually yeasts, okay, and several protozoa. We generally think of our accessory organs like your salivary glands and your pancreas, your liver, and your gallbladder and stuff. We usually think of those as being free of biota, typically. So again, our microbes provide a protective function through microbial antagonism and help digest our nutrients for us so that we can actually absorb them. But they also teach our immune system what they should fight and where they should fight it. So it teaches your immune system that the microbes in your gut belong there, but that if they were to get in your bloodstream, you would still be able to attack them and recognize them as such. So it kind of trains your immune system on what and where in your body we would see things as friendly or foe. And so it gives a massive, massive training opportunity for our immune system. And it also affects several other aspects of your body. There is a ton of research right now that links your gut microbiome and your population of what microbes are in there And then maybe whatever products, waste products, signaling molecules, toxins, or whatever these bacteria might make, highly, highly associated with your mental health. And your intelligence and your likelihood to gain weight or lose weight. All of this has now been very closely linked to your gut microbiome, which is a big thing. I'm moving on to our diseases. Already my back is hurting. Like I make it through Mondays fine. And then Tuesdays, not so good. Wednesdays, fine. And then Thursdays, my back again. So that's fine. Dental caries. Dental caries is another word for tooth decay. This doesn't always have to associate with true cavities or root canals or something like that. We're talking about any tooth decay at all. So if you have bacteria in your mouth, which you do, everybody does, it's part of your microbiome. So if you have bacteria in your mouth, they can ferment sugars. And when they ferment those sugars, they, just like our organisms do in our tubes that we studied, right? When you ferment sugar, what is the major product that's made? Acid, exactly. So acid. Some of them can also make gas if they ferment, but I'm not concerned about that. I'm concerned about the acid. The acid that organisms make when they ferment will break down your tooth enamel and can also then, even easier, break down the dentin underneath it. So this is where we start having tooth decay coming from. Destruction of the enamel and then destruction of the layers underneath the enamel. Most people that are having tooth decay, this will be caused by Streptococcus mutans and Streptococcus sobrinus. So this is actually, we're going to talk a little bit about some of the diseases associated with it in a little bit. But what happens is these bacteria can like stick on any like non-smooth surface of your tooth, which is usually going to be what we call the pellicles, in like your molars and things like that. And so they can stick in there or between your teeth as well. And then they create biofilms from there. And then other bacteria can stick to those biofilms a lot more easily. And this is usually going to be related to how much carbohydrates you consume, how often you brush or floss, your genetic aspects, and then what your microbiome is in your mouth that makes you more susceptible to having more severe issues related to tooth decay. So again, dental caries is what we call tooth decay, and it is the most common infectious disease in humans, period. Guaranteed everybody in this room has had some form of tooth decay. Whether you've had to have fillings or not isn't the question, but you've probably had some level of tooth decay to some degree. So here is an image of biofilm formation on the back of this dental patient's tooth that we've scraped off the biofilm that's associated with this. This is plaque. And then plaque can calcify and then become much more difficult to remove. And so brushing and flossing should be able to remove the softer versions of plaque, but once it calcifies, you have to go to the dentist to have it scraped off. You could use dental tools yourself, but then you're not trained to deal with that. They're probably not sterile. So you could be introducing other possibility for infection if you were to try to scrape it off yourself. So now we're going to talk about periodontitis, the initial stage of periodontitis, which is like actual, true, observable, diagnosable dental disease. Gingivitis is the first step of that. And so this is swelling, loss of normal contour, patches of redness, and increased bleeding of the gums, the gingiva. And so spaces or pockets will develop between the tooth and the gingiva, which is the gums. And then the bacteria can move deeper and deeper. And then the pockets, they're trying to get away from the bacteria. The gum tissue swells up and recedes. And then this can lead to recession of bone and recession, likelihood of losing the tooth at that point, because the bone and the gum tissue is what's holding your tooth in place. This is what leads to tooth loss there. So this is the normal tooth and gingiva situation here on the far left. In gingivitis, we start having inflammation of the gum and then recession of the gum line. This is entirely reversible in this stage. All you have to do is brush and floss regularly. I won't make you guys raise your hands, but I am wondering how many of you have flossed your teeth in the last 24 hours. So yeah, so some people are like happy to admit, nah, y'all, I floss every day. My dentist tells me to floss every day. Guaranteed most people do not floss every day. And you should be flossing at least once a day. You should be. If you're flossing at least every other day, you're probably in a good spot. Now, if you floss and you're going to tell me, well, when I floss, it hurts. You have gingivitis. That is what that is. That is that. If it hurts when you floss, you have gingivitis, period. That's why it hurts. So how do you, if it bleeds, for sure you have gingivitis. How do you get rid of that? You floss. Like, not even kidding. That's just how you do it. So if you have sore gums, if it hurts when you floss, or if it bleeds when you floss, floss more. So I would recommend starting flossing every single day. What I recommend, you can floss before you brush or after you brush. There's no real benefit to one way or the other. But I floss, then I brush my teeth, then I rinse with a mouthwash to make sure everything's all rinsed out and nice and clean. Every time I brush my teeth, I do those 3 things. And so some people will tell me, oh, your teeth are so nice. Well, I also hate to break it to you. My front teeth are all fake. They're all caps. And so this isn't because of tooth decay. This is because I've knocked my teeth out when I was a kid. And then I would continue to play sports and things like that and then knock those fake teeth out. And my teeth are very expensive. So my front teeth are fake. I have only had 1 cavity in my entire life. That is my very, very back molar. And you better believe that since then, I floss really well behind my back molars and make sure that I brush behind there as well. I use an electric toothbrush. I highly recommend electric toothbrushes because they'll remind you that you're brushing for 2 minutes. If you're brushing your teeth for less than 2 minutes, you are not brushing your teeth well enough. So 2 minutes of brushing twice a day, floss at least once a day, and rinse with mouthwash twice a day after you brush your teeth. I use and highly recommend, and every dentist will tell you, highly recommend a hydrogen peroxide based mouthwash. So I use one from Crest called Bacteria Blast. I just like how minty and fresh it tastes. I don't usually like hydrogen peroxide based mouthwashes because of the foaminess. I just feel like they have a weird taste to them, but this one is particularly minty and I can deal with it. So hydrogen peroxide based ones are more effective than like Listerine and things like that. So that's what I recommend, and that's what your dentist would recommend too if they were here. Also, hydrogen peroxide helps with whitening your teeth as well. And it's much safer than some of the whitening compounds that you get from like more professional. Anyways, what happens is the bacteria will grow on your teeth. If you do not floss, the bacteria will stay in between your teeth. And so you aren't brushing that out. That doesn't go away on its own. And so the bacteria will build up between your teeth, and that's where you're going to be likely to have gum recession, then bone recession, and then potentially need to have root canals, fillings and things like that, and even lose your teeth. Your risk of periodontitis through dental disease is going to be higher if you have Methanobrevibacter oralis. Methanobrevibacter oralis is an archaea. It's the only archaea that we will ever talk about in this class that is associated with dental caries. And if you have this bacteria, you're more likely to have severe presentation of periodontitis. Again, archaea. When we talk about the eukaryotes, the ones that lack a nucleus or organelles, we only have 2. That is bacteria and archaea. Everything else that is cell-based will be the eukarya. And then we have the viruses and the prions, that they aren't cells. All right. So things that also put you at risk for periodontitis, other than having Methanobrevibacter oralis, is behaviors. This will be like how often you floss or brush your teeth and things like that. Genetic influences. This would be things like you don't make as much saliva as somebody else, or you might have other things that are involved in oral health maintenance. Tooth position. If you have crowding of teeth, then you're less likely to be brushing or flossing adequately, so you're more likely to have tooth decay issues. And then the presence of mineralized plaque called calculus, that hardened plaque, is harder to remove even from brushing and flossing. And so that presence of that can lead to tooth decay as well. And all of this stuff applies whether you are a human or an animal. And so one thing that I remind everybody, if you have dogs, you are supposed to brush their teeth every day. Yeah. I don't either, it's okay. All right, but that's what they say. That's what the vets will tell you. You're supposed to brush them every day. If you're only doing it every other day, then you're probably doing pretty good. But honestly, most people that I know don't brush their dog's teeth, period. And so
better than most people.
Yeah.
We had a person come in and be like, we brush our teeth once a week. I was like, actually, that's pretty good.
Yeah. Yes. And so that's the thing, when my dog just had her teeth out, I was like, I brush her teeth every week. I know that that's not like as much as I should, but I also know that it's like considerably more than what most people do. And I mean, I was diligent about at least doing it every week, but you're supposed to do it every day. I'm just saying, so that you know what the recommendation is. Issues from tooth decay are like one of the leading causes of death of pets. So be aware of that. This is an image of somebody that has advanced periodontal disease. We have images of calculus where we have the dried hardened plaque, and we can see in the pockets in here we have the softer plaque. We have recession of the gum line. from the gingivitis as it has progressed. And then when you say that somebody is long in the tooth, this is what we're talking about, the recession of the gum line as a result of gingivitis and periodontal disease. And I had a student ask me in my Wednesday class about fluoride. So if you want to talk about fluoride and the benefits or the harmful aspects of fluoride, I'm happy to discuss that with you. And I want to remind you that the reason that people don't need dentures at very, very young ages like they used to is because of the introduction of fluoride into our water. Can fluoride be toxic? Yes, it can, but fluoride is also found in other things in nature, not just in your tap water. And no, it does not allow people to control your brain or something like that. No, there's no evidence of that whatsoever. If you ingest high amounts of fluoride, it can be toxic, especially to small, tiny people, which is why when you're teaching your little children how to brush their teeth at first, you'll buy them fluoride-free toothpaste because they're going to taste it and think it tastes tasty and try to eat it all. So a tiny little person like that having that much fluoride can potentially have toxic effects and stuff like that. But if you are a person just brushing your teeth and you're spitting it out, even a pea-sized amount, if you were just swallow toothpaste, a pea-sized amount isn't going to be a problem. But you should also be just brushing and spitting it out, right? So fluoride significantly decreases the ability of these microbes to grow because it is a halogen, and halogens are effective at controlling microbes. So anyways, if you want to talk about other aspects about fluoride and the dangers there, you just come and see me. Anyways, necrotizing ulcerative gingivitis and periodontitis. When we have the necrotizing level of periodontitis, whenever we have the bacteria that are actually causing death and necrosis of the tissue that it is infecting, this leads to a much more progressive and much more severe presentation of periodontitis. Actually leads to pseudomembrane formations where we have the biofilms growing over surfaces of the mouth. And this is a much more severe presentation. We call this trench mouth. And it's usually associated with one or more of the following bacteria: Treponema vincentii, Prevotella intermedia, and Fusobacterium species like Fusobacterium necrophorum, which was associated with peritonsillar abscess in pharyngitis. It's going to cause a much faster progression of periodontitis and lead to advanced bone destruction. And let me tell you, believe me when I tell you, that you are welcome that I'm not showing you these pictures right now, but you will probably learn about this in more detail if you go into medicine, because these won't just be seen by only dentists, I'm just saying. All right, moving on. Gastritis and gastric ulcers. So gastritis is when we have sharp burning pain emanating from the abdomen, and gastritis is usually more commonly associated with the upper part of the GI tract, and so we're talking mostly the stomach here. And so gastric or peptic ulcers are these sort of inflamed lesions that can form in the stomach and upper part of the small intestine. It's almost always caused by infection with Helicobacter pylori. It is a bacteria, and about half of the world's population has it as part of their biome in their stomach and small intestine. This is not uncommon, but that this guy, based on what you eat and how much acid your stomach produces and things like that, can put you at a higher risk for developing ulcers if you have this in your stomach. I was having severe upper GI issues for a while, and I still do. It just comes and goes, but it used to be very severe for a while. And it was so crippling, the pain, that I literally had passed out from it and called 911 and things like this for the pain. And it wasn't related to this. It was related to my allergy to the other thing, that, what did I say it was? The protein. Whey, thank you. Yes.
So I have a ton of GI issues. My stomach just falls very bad. And like 4 years ago, I got admitted to the hospital with my esophagus ulcerated, stress. So is this kind of like the same thing for that?
It can be. It can be. So I was having the stomach issues, and they're like, "Oh, it's definitely H. pylori. It's definitely that."
Yeah.
So I went and yeah, and so it's pretty common, especially because I was 30 at the time. So it's like 11 years ago or whatever. But they're like, "Yeah, you're old enough that this is probably the issue." So they do a special test for this. They do a special test for this. It's called the H. pylori breath test, or the urease breath test. So urease breath test. So we're going to talk about this for a second. So H. pylori is a bacteria that produces urease. So if we were going to culture it in our urea tubes, it would be pink, exactly. So there's that. But the other thing is, when you take this test, they're not culturing it and then looking at the urease test. They can do it pretty much on the spot. Like what you'll do is, you'll go in to DLO or whatever, you'll breathe into a bag, you exhale into a bag. I know it sounds weird, but you exhale into a bag and put a cap on it. And then you drink a weird drink, and that drink has urea in it. And it is radioactively labeled urea. So it's got carbon-13 radioactive carbon in there, which is extremely like safe. It's present in our environment. As long as you're not just drinking constantly carbon-13, like you're gonna be fine. So you drink this radioactively labeled urea. And then when that bacteria breaks down urea, we know it makes ammonia, which makes our tubes turn pink. What other compound does it make? Carbon dioxide. So when you break down urea, you get ammonia that turns your phenol red pink, but you also make carbon dioxide gas. And so when these bacteria break down urea into ammonia, who cares, and carbon dioxide is where that radioactive carbon will be. And so when you exhale the second time into a second bag after you drank this drink an hour later, if you exhale radioactive carbon, then that organism broke down urea into carbon dioxide. And that's how that test is done. Pretty cool, pretty cool. And it kind of also brings everything full circle. I kind of like that one. So go back to pylori. This is treatable with antibiotics. All right, let's move on to the diarrhea, because pretty much the rest of this is going to be diarrhea. All right, diarrhea is defined as 3 or more loose stools in a 24-hour period. So if you are having diarrhea for less than 2 weeks like this, that's acute diarrhea. If you're having diarrhea like this, 3 or more loose stools in a 24-hour period, and that's going on consistently for more than 14 days, more than 2 weeks, then that is chronic diarrhea. So we'll talk about the chronic diarrhea next, but we're starting with acute first. So about a third of the cases are caused from contaminated food. About the other 2/3 is usually going to be from environmental things, just like not having the right balance of nutrients or whatever, but also infectious reasons, like just fecal oral transmission, we call it. People not washing their hands. So it doesn't necessarily have to involve food in those cases. So if you're eating undercooked chicken and you get diarrhea, that might be caused by salmonella infection. But you also can get things like rotavirus or norovirus that don't always have to have food involved in it. It can just be from person to person transmission through the fecal oral route. Well, not washing their hands. So these are the top cases of foodborne illnesses, as well as the ones that are most likely going to lead to death. We're going to talk about most of these today. Salmonella. So this causes a disease called salmonellosis. It is a gram-negative motile bacteria, and we divide it up into serotypes based on its antigens. Those antigens are the H, K, and O antigens, the flagellar, capsule, and the cell wall antigen, and can relate to the LPS, or the endotoxin on the surface as well. These guys produce H2S, but not urease. And so these are ways that we can identify these guys. It's pretty common. Salmonella is a pretty common organism, but it takes a pretty large amount of salmonella bacteria to cause disease. So usually about at least I think 50 or 60 bacteria have to get into your body as a minimum to establish infection for healthy people. So salmonellosis is the typical presentation that most people would get if they ate like undercooked poultry, for example. You'll have fever, gastroenteritis, you'll have abdominal pain, you might have vomiting and diarrhea. If you get salmonella, it's not poisoning. It's not salmonella poisoning. That's incorrect, okay? It's an infection. So the bacteria actually multiply and infect your gut biome, okay? There's infection that's going on in your gut. So salmonellosis, if you have salmonella disease, it will last like a week. If you get sick and have diarrhea from eating something, let's say you eat something and you get sick within like a few hours, but it passes within a day, that is not an infection. We're going to talk about what that is in a little bit. That's food poisoning. That's a different thing. Okay. So salmonellosis, an actual infection with salmonella, you'll be sick usually for about a week. Typhoid fever is caused by a serotype of salmonella that we call Salmonella typhi. So it's Salmonella enterica, they all are. And then serotype typhi is the one that we call Salmonella typhi. And it causes typhoid fever. And this is when we talked about Typhoid Mary, who wouldn't wash her hands. And so she was serving and cooking food for people, and people were getting typhoid fever as a result. But she didn't have the disease because she was a carrier. And so what happened was, in her gallbladder, she had a biome basically consisting of Salmonella typhi. And when she wouldn't wash her hands, some of that bacteria would get transferred to the food of people that she was serving, and they would die from typhoid fever. It's a much more severe presentation of the disease. Shigella causes the disease shigellosis. Shigella is also known as Shigella dysenteriae. It is a gram-negative rod. It is non-motile. It is going to cause the most severe form of like a dysentery that you would typically get from foodborne illness. It's usually caused by Shigella. Well, maybe Shigella and the next one we're going to talk about. But the whole deal with Shigella is that it causes dysentery, which is bloody diarrhea as well as high amounts of mucus in your stool. So high amounts of mucus and blood is dysentery. Nausea, vomiting, and fever also accompany Shigella infection. And it has these toxins, the enterotoxin and specifically the Shiga toxin, that causes serious damage to your intestine that leads to the bleeding of the inner lining of your intestine. And this is what presents as the dysentery. So on the left here, we have the normal GI tract, and on the right, we have the effects of Shigella. You can see quite clearly, we've got a lot of inflammation. We have the loss of the crypts that are usually normally seen in the intestine that helps with nutrient absorption and things like that. And the shedding of the lining of the intestine as well, leading to that bleeding. All right, moving on to E. coli stuff. We have quite a few E. coli. So we're just getting started with E. coli. E. coli, this one, E. coli 0157H7, also known as STEC. STEC stands for Shiga toxin producing E. coli. All right, so this is E. coli that produces that Shiga toxin. So this is that toxin that led to dysentery in Shigella dysenteriae. So this is E. coli that can produce that toxin. So this will lead to dysentery, bloody diarrhea. So we can have mild gastroenteritis, but you also can have dysentery associated with this guy. It's a particular strain of E. coli. So normal E. coli that's part of your gut biome is a different strain. It's not this. And so it can be associated with other things when it gets out of place. But this is a completely different strain. And when you guys hear like recalls of food because they have E. coli, it's this E. coli that they're worried about. Most common concern in foodborne illness is going to be this E. coli, STEC. It can lead to hemolytic uremic syndrome. Basically, like the endotoxin and the Shiga toxin together cause so much inflammation and damage that we have anemia developing, we have damaging of red blood cells, and then this causes damage to the kidneys as well from the inflammation and the ruptured blood cells. And so that's what hemolytic uremic syndrome is. We have anemia from the broken red blood cells. We have kidney damage that can be permanent and it can lead to death as well. Other E. coli. All right. So the bottom two are probably the only ones that I'm going to give a damn about. All right. So we're going to talk about enteroaggregative E. coli in a little bit. But for now, let's move on to the bottom one, which is diffusely adherent E. coli, which will also come back up in the next chapter, our last chapter, chapter 23, when we talk about the genitourinary diseases. So diffusely adherent E. coli, they have fimbriae that are better able to attach to your cellular endothelium of the bladder and the urinary tract. And so this is the guy that leads to the urinary tract infections. Like 80% of all urinary tract infections are caused by E. coli, and it's usually this diffusely adherent E. coli that just came from your own gut biome. All right, moving on to Campylobacter. This is definitely the most common bacterial cause of foodborne diarrhea in the United States. Signs and symptoms will be frequent watery stools, fever, vomiting, headaches, and severe abdominal pain. Most people will have a low-level disease associated with this that won't put you in the doctor, so a lot of times this goes undiagnosed. But more often than not, if you're having an illness, a foodborne illness from undercooking your food, it is less likely actually to be salmonella. It's just if you get salmonella, you're probably going to need to go to the doctor for it, but it's more likely to be Campylobacter, and you're likely to get over it on your own. So definitely be sure that you're cooking your food all the way. You're definitely going to want to cook your food all the way after this chapter. Since signs and symptoms may last longer than 2 weeks, and we might have severe presentation of like Guillain-Barré as a result of a neurological effect from having this infection, but it's not common. It's usually going to cause a mild diarrhea that you will get over with on your own. This guy's a microaerophile, and so he doesn't need as much oxygen to survive, which is actually helpful in identifying these organisms. We don't usually test for this in most food. I can assure you of that, being somebody that tested food for a while. It's just common. We just assume it's there, sort of like one of the other diseases that we're going to talk about in a little while. All right, Clostridioides difficile, previously known as Clostridium difficile, and it's still categorized as a Clostridium bacteria. So this is gram-positive, it is endospore forming. We actually know that if you are Clostridium or Bacillus species, you must make endospores. And because you make endospores, we know all endospore forming bacteria are gram-positive. So we actually know that about this guy already. This guy causes a disease that we call pseudomembranous colitis. Of course, you call this C. diff in the hospitals, but the disease that it presents as is pseudomembranous colitis. And I'll show you a picture of it in a moment of the disease presentation with a colonoscopy. But you can treat this with some antibiotics. They'll have to be much more severe. And it's actually precipitated by treating with antibiotics to prevent other infections. So this would be like you got surgery, they give you antibiotics to prevent the infection. It clears out your gut microbiome, and these guys will overpopulate because there's now empty stadium seats. It was already there in your gut usually to begin with. But if it wasn't, and you're on antibiotics at the hospital for some sort of other infection and your gut biome was cleared out, if this guy gets transmitted to you, now you have C. diff too. Congratulations. Endospores are easily transmissible and very, very hardy and hard to get rid of. So this is a common infection that spreads very easily throughout hospitals. So we'll have to have pretty strong antibiotics to treat this guy. And usually what we'll try to do is give you those strong antibiotics to clear out all of your microbiome, including C. diff, and then replace your biome with a fecal transplant from somebody that you're close to in life so that it is likely to repopulate. So on the left here, we have a normal colonoscopy. And on the right, we have, if you're giving a colonoscopy, a complete membrane formation blocking off the colon. This is that pseudomembrane. Prevents the transfer of fecal matter throughout the colon. All right, moving on to, in C. diff, if you have diverticulitis, you're actually really likely to have a very serious issue with C. diff because this guy, when you have diverticulitis, you have a lot more pockets in your colon than what most normal people do. And those little pockets can like trap things in them, which is why people with diverticulitis are like advised not to eat things with tiny seeds and things like that, because they'll get trapped in those crypts. C. diff gets trapped in there too. And this makes it incredibly difficult to treat people with diverticulitis who have C. diff because the antibiotics just don't get into those crypts very well. My mom has that, so that's why I know a lot about it. All right, Vibrio cholerae. This is the causative agent of cholera, at least it's in its name, right? So let's talk about this disease. Cholera involves vomiting and copious, I mean copious, very pronounced by the copious amounts of watery feces. We call it rice water stool because once you get into true cholera effects, your poop doesn't look like poop anymore. It won't even be brown. It will literally look like you scooped water out of cooking rice, white and translucent. That's what's coming out of your booty when you have cholera. So this leads to profuse water loss in the body. So you're massively, massively dehydrated, but you're not just losing the water of your body, you're also losing all those electrolytes. And those electrolytes are essential for your muscle function. And so what we have is loss of blood volume because all the water is being pulled out of throughout your entire body and then being expelled through the intestinal tract. We have acidosis of the blood, potassium depletion, which is one of the electrolytes that's being lost, muscle cramps because we can't control muscle movement very well anymore because our electrolytes aren't there to help maintain that. We have severe thirst, flaccid skin, and sunken eyes, all related to the dehydration aspect throughout the tissues of the body. This often leads to convulsions and coma in young children. We talk about this like this is something that's really more severe for young children, but I want to be very clear about this. This disease has a 55 to 70% mortality rate. Even with treatment, this is a very difficult disease to control because treating the bacterial infection, the bacteria produce the toxin, right? But the bacteria are living in your colon producing this toxin. And if you're constantly flushing out everything in your GI tract, how is an oral antibiotic going to get there? It's just going to get flushed out, right? And if you are delivering antibiotics through the intravenous system, we're just going to flush those out of your veins and back into the water that's getting pulled out of your bloodstream and just flush that out. So antibiotics are usually not effective for treating cholera. They can help some. I mean, it's like better than nothing sort of a situation, but it really isn't helpful. Usually we'll just have to wait for this disease to clear itself up. And so we have these things called cholera beds. And it's just like a cot that's a hole where your butt is, and we'll put a bucket under you and let it run its course. This is a really common disease in third world countries, underdeveloped countries, or in situations where we have very close living situations, like what we saw with the earthquake in Haiti. There were people that were, dislocated from their homes and they were living in like these shanty towns, and even people that were going out there to help them, they were having contact with these people. This is a fecal oral transmission route. It can contaminate water, which is the most likely way that it's going to get transferred. So water sources were being contaminated from this bacteria, and people who were out there to help, even the doctors from America and things like that, were coming back with cholera as a result. So the thing that's associated with causing the disease is the cholera toxin that causes massive, massive expulsion of fluids and electrolytes from the tissues and the bloodstream. Associated usually with water. There's other species of Vibrio that are associated with other diarrheal diseases that are more common in things like oysters and things like that are just found in marine environments. So when you get oysters, if you're eating raw oysters, if you get sick from that, then it's usually a different Vibrio species, but it presents with a very similar disease. The best treatment for this is oral rehydration therapy. We just want to keep pushing fluids, and definitely electrolyte heavy fluids like Gatorade and stuff like that, and hope that the body's able to absorb it, because if we put it in the IV, it's just going to flush it back out of the bloodstream. But we can give you IV fluids, we can give you oral fluids, and we can give you antibiotics, but it's more or less just a wait and see kind of infection. Next is Cryptosporidium. This is a protozoa. This is an apicomplexan, non-motile protozoa, just like malaria was. But this doesn't multiply in your blood. This guy lives in your intestinal tract. And the cyst, so this is a protozoa that can switch between the cyst and the trophozoite forms. And the cyst version of this, again, this is a hardy, very much like endospores. The endospore version for protozoa is the cysts. And this is very resistant to chlorine treatment. And so these guys can actually survive very well in like swimming pools that are chlorinated. And so if you've ever swam in a public swimming pool or been a lifeguard at one, if you're a lifeguard at a swimming pool, you know, man, you know. But people poop in that water all the time. And it doesn't take very much poop for there to be these cysts that are released, and they're highly infectious. And once the cysts get into your body, then the cysts will turn into the trophozoites, and the trophozoites are the ones that multiply and create the toxins that lead to diarrhea presentation. Next is rotavirus. Very, very commonly transmitted from person to person. Fecal oral, contaminated food, contaminated water, and fomites also. So indirect transmission, contact transmission involved for rotavirus. This is absolutely the #1 cause of diarrhea in people by far. It's just not usually going to be diagnosed. So you get this and you get over it. Diarrhea. There is a virus or a vaccine available for this virus for little babies that might be more at risk for the serious presentation, but most people are just going to get over it. Next is norovirus, another very commonly transmitted fecal oral transmitted virus from food and water. This is more common on cruise ships where we have close living quarters for like a couple weeks, and people that aren't washing their hands properly. So this is the cruise ship illness. When people say they get poopy disease on cruise ships, it's usually norovirus that's the culprit here. It's extremely contagious. It only takes 1 to 20 viruses to cause the disease. Norovirus. Moving on to the food poisoning, guys. So this is when you get acute diarrhea, but it's caused by the toxins produced by bacteria. So you do not need to be infected by these bacteria to have the illness. And almost always with food poisoning, we call it food poisoning because you're being poisoned by the toxins. We also call it intoxication. But the toxins produced by the bacteria make you sick. And these toxins can be present on your food without you needing to get infected with the bacteria. The most common by far is going to be Staphylococcus aureus. Staphylococcus aureus produces a toxin that leads to onset of things like nausea, vomiting, and diarrhea within 1 to 6 hours of eating your food. Whereas things that are going to cause infection, like Salmonella or E. coli, it's going to take a couple days before you ever have symptoms. But with staph toxin production, the staph that are on the food, they're usually from people just handling it with their hands. The staph that's on the food create the toxins, and then you ingest the food, and the toxins will lead to the signs and symptoms associated with this. So onset is usually within 1 to 6 hours of eating the food, but you will be clear of the signs and symptoms usually within 24 hours. So if you have a 24-hour stomach bug, it's usually staph. Like by far, it's usually staph. We will not treat this with antibiotics. Why? Because you're not infected. It's only the toxin. So it's a self-limiting presentation of disease. Once the toxin is gone, you don't have any risk of having any more illness. So it's going to let it run its course, sort of thing. There's 2 other bacteria that are associated with similar sorts of presentation. That's going to be Bacillus cereus, again, endospore forming. These guys are well known to be found contaminants creating toxins under like heat lamps. So we're talking about things like fried rice and stuff like that that's kept out for a while in a heat lamp environment. The toxin that they produce, again, similar presentation. Same thing with Clostridium perfringens, the exact same thing. So this is a guy that's associated with gas gangrene. But if they're found on your food, the toxins that they produce can also lead to food poisoning. All right, moving on to chronic diarrhea. Diarrhea, again, 3 or more loose stools in a 24-hour period. If that continues for 14 days or longer, that is chronic diarrhea. You might have presentation of this type of disease from non-infectious ways, like by having IBS, ulcerative colitis, or something like that. But we're talking about the infectious versions. The first is coming back to our E. coli. This is the enteroaggregative E. coli. Presents with chronic diarrhea, but it is usually associated in children and people with HIV, lower immune system situations. Large amounts of mucus produced with this, but it is diarrhea. You shouldn't usually have dysentery with that. So next one is Cyclospora cayetanensis. This guy is a protozoa. Again, the cysts are associated with chronic diarrhea for this one. Then it's Giardia duodenalis or Giardia intestinalis or Giardia lamblia. They're all the same thing. It's all the same species. They just keep freaking renaming it. So giardiasis is the disease that it caused. This is a flagellated protozoa that is transmitted in fresh water. It can be found in freshwater streams, ponds, lakes, as well as even in tap water. Signs and symptoms, diarrhea that is chronic. You also have abdominal pain, a lot of flatulence, and then greasy, malodorous stools. And this can go on for years. It can also become part of your gut biome, and then you can transmit it to other people without even knowing it. This is a protozoa that does have a cyst and a trophozoite form. The cysts can then survive outside of the animal host environment for 2 months, even in fresh water. So that's where the big issue comes from. Even if your water is sparkling and clear, it could have the cysts in there. So this is commonly maintained in animal populations and transmitted through their fecal and urination, mostly fecal. But there are trace amounts of these pretty much in most freshwater areas in the world. So that's giardiasis. But then we can talk about Entamoeba histolytica. This was the one that we looked at it in the lab. It was the blob with the blobs in it, okay? But it's an amoeba, and it does have a cyst and a trophozoite stage. This guy is different from, so it's transmitted the same way as giardiasis is, so food and water contamination. But this guy leads to dysentery. So that's the difference here. So giardiasis, greasy malodorous stools, that's bad enough. But Entamoeba histolytica can lead to dysentery and massive hemorrhage in the bowels as well. So this can be deadly because of that. Let's talk about hepatitis. Hepatitis is inflammation of the liver. It can lead to necrosis and death of actual liver cells, hepatocytes. If this continues long enough, you'll have scarring of the liver, which we call cirrhosis, and that's irreversible. If you have a cirrhotic liver that has liver cirrhosis, the scarring of the liver from the inflammation, either from infection or from something else, that scarring leaves you considerably more susceptible to having cancer in your liver later on. So let's talk about the causes, the infectious causes of hepatitis. We're going to talk about the hepatitis viruses. They're all viruses. Hep A, Hep B, and Hep C. They are not related to one another in any way. They just cause a similar disease. All right, so Hep A is usually going to cause a subclinical presentation of disease. Most people that get Hep A, they don't have a very severe disease, but some people will present with hepatitis and jaundice occasionally. So the issue here is going to be whenever this leads to hepatitis, like actual hepatitis presentation or jaundice, that's when we have the more severe presentation of the disease. Most people just get over Hep A. This is something that's present in, this is a fecal oral transmission. Regular fecal oral transmission, commonly found in the environment, in water, and things like that. There are immunizations available for Hep A. Most people get over it, though, on their own. It's not very severe. But Hep B and Hep C are the worst ones, okay? So Hep B, this is a DNA virus. And get this, Hep B is a DNA virus that has reverse transcriptase, which is weird to think about because we usually think of reverse transcriptase takes RNA back to DNA, right? Why would you need to take DNA? If DNA to DNA is called replication. But what this virus does is it gets into your cells, and then in your nucleus, it transcribes the DNA, just like we do. With our DNA, we transcribe it to RNA and then translate it to proteins. So while it's doing that, it makes an RNA copy of its genome, just as its normal for translation. So, but then it takes that RNA and makes a DNA copy of that. I don't know why. I don't know what the logic is, but it does that. And so that DNA copy can then be inserted into your genome and become part of your genome, and then disrupts your cell cycle because of that, and that can lead to cancer. So Hep B is associated with hepatocellular carcinoma, hepatic cancer, liver cancer. There is a vaccine available for Hep B. It's transmitted by very minute amounts of blood. So this can be sexually transmitted as well as through intravenous exposure. There's a vaccine available, but there is no treatment for Hep B. If you have Hep B, you're pretty much either have to get over it on your own or you're going to die from it. So get the vaccines for A and B. Hepatitis C. There's about 3 million Americans infected, and it seems to be spreading. Signs and symptoms will be similar to Hep B, and many people with Hep C will remain infected indefinitely. They don't just recover from it. Like you can potentially recover from Hep B on your own, but Hep C, most people won't. There are drug treatments for Hep C. They are extremely effective and it can cure you, but once you get into chronic hepatitis caused by Hep C, you're less likely to be able to recover from it. This is transmitted by direct blood transmission. So we're talking intravenous drug use and blood transfusion. This is not typically transmitted through sexual transmission here. There's no vaccine for Hep C. There is treatment though. So keep that in mind. Hep A, you usually get over it. It's not severe, it's oral fecal. Hep B, little amounts of blood, sexually transmitted as well as blood transmission. There is a vaccine for Hep B, but no treatment. And then Hep C, there's no vaccine, but there is treatment. And it needs a little more blood to be transmitted. Let's talk about our helminth diseases. Most of these are neglected tropical infections, things that are severely affecting other populations that we call them underdeveloped countries, but or third world countries, whatever language you want to use. These are the poorest countries of the world, have high incidence of helminth infections, where we don't really see helminth infections that much here in the United States or in developed countries. Most of these guys have these are multicellular organisms. They have mouth parts, they have intestinal tracts and everything like that. And they will cycle from like egg to larvae to like larger versions, adult versions and there's all sorts of like steps in between. Some of them require an intermediate host, but the definitive host is the host where we have sexual reproduction occurring. How do we diagnose these infections? It's usually going to be diagnosed by in the blood tests. If you have high eosinophils, those are the white blood cells that are going to be targeting helminths. And then if we look in fecal samples or in biopsies of tissues, if we see the eggs, larvae, or adult worms. None of these have vaccines. The way to treat them is with anti-helminthic drugs, things like ivermectin, praziquantel, and stuff like that. Controlling water treatment and proper sewage disposal is incredibly important for preventing these diseases, as well as washing and cooking your foods. Freezing the food can also prevent the worms from surviving as well. They don't survive being frozen very well. All right, so let's talk about the diseases of the helminths. The first one is Enterobius vermicularis. That's the organism, and it's also known as the pinworm. It's the most common worm disease in temperate zones, including the United States. It has pronounced anal itching, so if the little kid has itchy booty, you keep scratching at the booty. We'll put tape on the butthole overnight, and when you remove the tape, if there's worms stuck to it, that is pinworms. And so usually this is it's not a fatal infection, but you do need to treat it, and it's just treated over the counter with ivermectin. You can buy at the grocery store, just at Walmart. Next time you're there, look, see if you can find it. Ivermectin over the counter. So if you have a kid that has pinworms, most of the time the rest of the family also has pinworms. So you treat the whole family, kind of like if you have a kid that has lice, you usually treat the whole family for it. It's kind of like that. All right, next is trichuria, also known as the whipworm. This only exists in humans. We have high incidence in tropics and subtropics. These female worms may lay massive amounts of eggs every day. And the inflammation caused by the infection with these guys can cause rectal prolapse and things like that, where we lose muscle tone in the GI tract, and the rectum will then expose itself out through the anus. Next is Diphyllobothrium latum. This is the tapeworm that is found in undercooked fish like sushi. This is a tapeworm associated with sushi. Then we have Hymenoplepsis species. These are tapeworms. We usually call them rat tapeworms. These are maintained in like animal populations and can sometimes get spread to people, though it's less common. Next is Taenia solium. Taenia solium is definitely by far the more commonly known tapeworm. This is that really long one. So adults are up to 5 meters long. They're distributed worldwide. We have them all over the world and are commonly transmitted by pigs, though cattle can have this as well. So very commonly maintained in livestock population. If you ingest the egg, so if you ingest tissue that has an infection in it, like meat that has some of the cysts in it, then you will get a tapeworm in your belly. But if you ingest the actual egg sacs themselves, so those little pieces, you see how there's like segments of these guys, you can kind of see them in here. Those little segments are called proglottids. And each of those segments has like several eggs in it, like 30 to 100 eggs inside of them. If you ingest a proglottid, which used to be a common practice to control weight, so it used to be able to sell like tapeworm proglottids, tapeworm eggs, you can ingest them and supposedly get a tapeworm in your belly, which you sometimes can get from ingesting the proglottids. But it would like absorb your nutrients so that you could eat what you wanted, but the worm would absorb the nutrients. But you also have a worm in your body, just to be clear, right? There's other problems with having a worm besides just eating your calories. The inflammation, the disruption of your gut biome, and all sorts of diarrhea, intestinal pain, bloating, all sorts of this that can be caused by having tapeworms. But more commonly, if you ingest the proglottid, you're actually more likely to have cysticercosis. And this is whenever what happens is the cysts will infect tissues of your body, and in humans, this presents usually as presentation in the brain. And so the eggs will develop into larvae in the brain tissue of people, and that's neurocysticercosis, what that is called. And it's extremely difficult to remove these cysts. First of all, they can be anywhere in the brain tissue, and so they might be deeper in like the cerebrum. But if you rupture one of these cysts during surgery, it causes an instant inflammatory response in the brain that can be nearly instantly fatal. So this is extremely difficult to treat. Next is Ascaris lumbricoides, also known as the giant intestinal roundworm. Again, roundworms, nematodes, yes. So the larval and adult stages will exist in humans, and then the adults will excrete eggs that get expelled in the feces. These guys will penetrate the intestinal wall, causing all sorts of GI symptoms and circulatory issues as well, because the larvae can actually move within the tissues of humans into the circulatory system, where they then find themselves in the lung tissue. And they can migrate up this ciliary tree, and then the worms will cause tickling in your throat. You cough, and then swallow them, and it causes reinfection of the bowel that way. So it's not uncommon to see people with infection with the Ascaris lumbricoides to have worms that they'll cough up as a result. So they are this size. So you will see some images of people that have this, like worms will literally be coming out of their nose and mouth sometimes. It's less common to see the adult-sized worms doing that, but it is not that uncommon to be coughing up the worms, the smaller versions of the worms, as a result of this. So they can migrate throughout the tissues. The typical cycle will be adults in the gut, and larvae can then migrate, or smaller worms can migrate through the circulatory system into the respiratory tree and then cough up and swallow them again. This is the most common helminth infection in the world. The most common helminth infection in the whole world. And so we talk about little kids getting pinworms all the time, and oh, isn't that funny? The rest of the world's population is dealing with this. The most common one. All right, moving on to Opisthochus sinensis and Clonorchus sinensis. We saw these guys in the eukaryote lab as well. These are known as the Chinese liver fluke. They will kind of like hide out in the bile duct and can potentially block the bile duct, causing symptoms similar to like gallstones and stuff like that. That can lead to hepatomegaly and issues with hepatitis and things like that, if that becomes a serious issue. Next is trichinosis. This causes muscle and neurological symptoms. What happens is that these worms will move into like your muscle tissue and also create like physical anatomical cysts there. So this is the issue when we talk about cooking your pork, is that you can have these worms in the muscle tissue of the pig. And so you're supposed to cook your pork thoroughly. You can still get this in other animals as well, including beef livestock. It's usually more regulated in beef. So you're safer eating undercooked beef, but do not ever undercook your pork because of this. It's likely where religions of the world started saying to not eat pork in general is probably because of this too, we think. Speculation is. So this guy, again, is a worm, gets in through your GI tract, and then by eating undercooked meat, and then migrates into your muscle tissue and can affect the nervous system as well. Signs and symptoms, you'll have diarrhea, nausea, GI stuff at first, and then it will lead to massive inflammatory response throughout the body, causing puffiness around the eyes, muscle and joint pain, shortness of breath, and eosinophilia, which causes massive inflammatory response throughout the body. Next is the liver disease caused by schistosomiasis. So these are, we're going to talk about bladder disease in the next chapter caused by schistosomes, but these are flukes also. So they're flatworms, version of flatworms, platyhelminthes. The flukes are known as the trematodes. Now these guys are called schistosoma masoni or schistosoma japonicum. They are different species by far. They look completely different from one another, but they cause a very similar presentation of disease. They get in through intact skin. Intact skin. So what happens is these guys, if you get in fresh water that is contaminated with these guys, they literally migrate in through your intact skin on your body.
Burrow?
Yes, they burrow in. And we call that area, like they'll call this a rash, an itchy rash where they get in. We call that swimmer's rash. And so what happens is the life cycle of these guys, as you see here, they get, excreted by the animal that's infected with them, in this case, people. Then that water becomes contaminated from urine or feces, usually urine. And then those guys move into a life cycle in the snail. The snail lead out to a certain phase of these schistosomes that then can burrow in through the skin. So it does have a life cycle in snails. So fresh water that has snails in them is the most likely place that you're going to have this. We mostly see this in tropical and subtropical areas of the world. This is not found in the United States, but chronic infection can lead to affecting the liver and the spleen because these guys do multiply in the bloodstream. It's a blood fluke, is what we call it. It causes hepatomegaly, enlargement of the liver, liver disease presentation, including potentially things like jaundice, and then splenomegaly as well, because again, these guys are in the bloodstream and they're causing inflammation and damage in the blood, which is filtered by your spleen. They can also move into the bladder because they move throughout all the tissues of the body. If they move into the bladder, they can actually cause bladder obstruction, and so you can have an inability to relieve yourself and that sort of stuff. They are able to change the antigens on their surface, kind of like malaria can. So we haven't been able to have any vaccination for this, and it evades the immune system very well by doing that. And it can also cloak itself with your own blood proteins. So in being in your blood, it just covers itself with your own protein, so it looks like self to your body. It's great, man. So yes, so we can identify these by the eggs that are excreted in the feces and the urine. And it's most commonly associated with untreated sewage being leaked into those freshwater systems. We treat this with praziquantel, which is our antihelminthic drug.